Let's start with occlusion. We'll take a look at the occlusion. We'll take a look at it in two condylar positions. One is maximum intercuspation, which is dictated by the teeth. Checkers patients tend to have a class 1 malocclusion. Chess players tend to have a class 2 malocclusion. Real easy way. The second way we're going to do it is we're going to look at the condylar position from a skeletal perspective. That'll be a fully seated condylar position. We're looking how the anterior teeth fit. If they touch or they're uncoupled less than 2 millimeters, we're thinking, okay, it's probably a relatively stable case. However, when you start to see the uncoupling on the right side of the screen, take a look at the canines as they start to drift towards one side. We can see everything's drifting towards the left. We'll come back and look at that case later. We'll move to the teeth and we'll look to see if they have a history of orthodontic treatment, specifically class 2 ortho treatment. You can see Gigi on the right has had maxillary premolars extracted, so we know there's a compensated bite. We know there's a camouflaged bite. We'll start to take a look at occlusal planes. Bill Arnett talked about this in terms of leveling occlusal planes. You can see we either see irregular occlusal planes in chest patients, like a stepped plane as we see in Betty, or we see a canted plane. Very interesting case. We're going to look at Jennifer's case, but those are the occlusal plane problems we see. If we now move to the skeletal side, we start to see also arch development problems. We see a constricted arch in chess players like Tracy and Ilya talked about during their beautiful presentation. So you start to understand the things that we look at on a regular basis. We look at mandibular and maxillary projection. Chess players or chess patients have retrognathic mandibles and maxillas, kind of the same thing that we've been talking about over these last couple of days. Facial asymmetry usually occurs in chess players, as we see Amaya's case. We're going to come back and look at her case in a minute as well. But when we start to see things drifting, we have to understand that we may have a more complex case than we think about. Finally, from a pain perspective, if we have pain less than 5 on a scale of 1 to 10, probably a Checkers patient. The patients that tend to have more complex pain issues are the ones that tend to have more structural breakdowns. So we're probably thinking if you have pain greater than a 5 on a scale of 10, it's probably a chest patient. So here's how the patients present from a Checkers perspective and from a chest perspective. Let's make it easy though. Basically, Checkers patients present with problems at the tooth level. These are predictable cases. We can all do these cases. Everything we learned in dental school almost works perfectly with these cases if the problems are solely at the tooth level. As we have seen over the last 2 days, though, we see a lot of patients that have problems at the skeletal level. Those are the chest patients. Now, what determines if we're playing checkers or chess? In my belief today, I think it's whether the disc is covering the condyle in the growing patient. You know, that's ultimately what determines the skeletal growth that we're starting to see. If we have an intact disc condyle assembly, it increases the likelihood we're going to have of genetic growth to the full potential. Now, let's take a look at a case where the discs are off. If that's the case, what we start to think about is there's an increased likelihood we're going to have a growth deficiency at the skeletal level. Jennifer's arcanoid occlusal plane case we just saw, you can see her discs are off. And now when we look at her skeleton, we can see why she has a canoid occlusal plane. The right ramus length is compromised. When you look at it on the CBCT, she's 5 millimeters short on the right side. That's the problem. Also, though, if you look at the condyle, it doesn't fill 2/3 of the joint socket. If that's the case, what we start to think about is that this had to happen before growth was completed. These cases happen early. We need to be aware of that.